This is Bart Frazita from Manalapan, New Jersey, a proud cancer survivor now for 7 years. You were diagnosed with esophageal cancer. Did you have any signs, symptoms, or clues that you indeed had this?
The first indication was I was over in Germany at a business meeting and went out to dinner and had a piece of steak and it got stuck in my esophagus. I thought I was having a heart attack. I stood up quickly from the table because I had a lot of pain in my chest. And when I got up, the piece of meat must have cleared because the pain went away instantly. And I just said I must have not chewed my food well. Came back to the States subsequent to that, had a luncheon. Same thing happened with a chopped meat sandwich. So basically said that was the time I should see a doctor, and went to see a doctor. They did an endoscope and effectively said I had a stage 3 5-centimeter tumor as Dr. Baines indicated, and as an adenocarcinoma at the juncture of my stomach and esophagus. The treatment here at Sloan is for a stage 3 tumor is chemo, radiation, and then surgery. The chemo that I went through, which is a lot different than it is today, was 24 hours a day, 5 days a week for 6 straight weeks. And during that same 6-week period, I took radiation. So halfway through the process, although I wasn't getting a lot of symptoms or reactions to the chemo or the radiation, halfway through the process my blood count had dropped a bit and they decided to stop the radiation. But when the radiologist spoke to the oncologist, he said, no, let him go through it because he's strong enough, he can handle it. I felt like killing my oncologist at that point, but be that as it may, we continued the process and didn't finish it on time. And the tumor had shrunk from a 5-centimeter tumor down to a 1-centimeter tumor. We waited 2 months post chemo radiation, and then Dr. Baines did my surgery. In the surgery, mine took a little bit longer than most because I was overweight, number one, and number two, had a lymph node in a lung that was not showing up as cancerous, but Dr. Baines wanted to go in and take that out to make sure it wasn't cancerous. But in the surgery, it's usually a 4 to 5 hour surgery in which they'll, in my case, took out 2/3 of my esophagus and 1/3 of my stomach, and then stretched the remaining part of my stomach up to attach to the remaining part of my esophagus. So right now, my stomach starts somewhere in the middle of my chest.
And it almost sounds to me, and you can correct me if I'm wrong, that it sounds almost like the stomach reduction surgery that so many overweight people are getting these days.
It has the effect of that.
So how did your life change after the surgery, the chemo, the radiation? What changed for you?
Actually, two things change post-surgery. One is eating, one is sleeping. Eating, since your stomach now is smaller and you still need the same number of calories you were getting when your stomach was at full size, you have to eat more meals. You have to eat 6 meals a day as opposed to the 3 that you used to eat. And then the second thing was sleeping. Because they removed the valve that is on top of your stomach, effectively you can't lay flat in bed because everything in your stomach would just roll up into your throat. So you have to sleep on an angle, about a 30-degree angle. And both those things, when you come to realize that everybody should eat smaller meals whether you have this cancer or not, and everybody should sleep on an angle because that's just good common sense. So these two things, which I call a little different normal, is really what everybody should be doing. So there really isn't that much of a change after it.
And
after surgery, Dr. Baines, I had asked him, what could I do to effectively give something back to Memorial and to him for what he did for me. And he mentioned the volunteer program at Sloan, a patient-to-patient program in which a patient who goes through a cancer comes back and walks the journey with patients who are hearing about it for the first time. The process goes something like this. Dr. Ilsen, who is the medical oncologist, will go in and talk about the chemo radiation aspects that they're going to go through. And Dr. Baines follows that with the surgery that he'll perform. And then he asks the patient, would you like to talk to someone who has been through it all? And I guess there's a question in their mind as to what this patient is going to look like when he walks in the door. And some of them say yes, some of them say no. But the ones that say yes when I walk in the door, it's like you can see their eyes light up a little bit that there is, hey, that he doesn't look half bad. And that's been a positive thing for patients, to know that there is a light at the end of the tunnel and that it isn't negative and that it isn't something that's going to knock them down and kill their quality of life. We produced a CD-ROM about this cancer, and the Esophageal Cancer Education Foundation, which we formed, to raise the money to do this CD-ROM. It raised $75,000 and worked with Memorial Sloan Kettering in producing this CD-ROM that's handed to each patient that is diagnosed as an esophageal cancer patient. In addition to that, Dr. Baines, myself, and two nurses, Pam Janex and Jackie Hansen, wrote a book called 100 Questions and Answers About Esophageal Cancer. And that book can be purchased through any bookstore. It's a Jones and Bartlett publication. The key here is early detection, and the only place we can do that is in this type of an area. I mean, Sloan Kettering, 48% of the patients that we do surgery on here have acid reflux or heartburn as a cause. 52% have no symptoms at all. So there is that element that we don't know about yet, and that's the sad part about this cancer, is that because there's so few cancers each year, the attention to it is not significant. And that's part of what we're trying to do with the CBS radio and other announcements, is to literally get the message out to the public, to let them be aware of what's going on, and hopefully they'll move in the right direction.
Well, congratulations, and
you.
Thanks for spreading the message about esophageal cancer.
Thank you very much.
We're here with Dr. Manjit Baines, attending surgeon at Memorial Sloan Kettering Cancer Center, and we're talking about esophageal cancer. Dr. Baines, tell me how common esophageal cancer is in the United States.
It is not a very common cancer. It's about 4% of all the gastrointestinal cancers, about 1% of all the cancers, about 13,000 cases a year, of new cases a year.
What types of esophageal cancer are there? There are different types.
There are several different types, but there are two main ones. At this time, the most common cancer is an adenocarcinoma that usually affects the lower end of the esophagus at its junction with the stomach. The other type is the squamous cancer. That is not as common, but it's interesting that over the past 3 or 4 decades, the types of cancer and how often they are present has changed very drastically. Adenocarcinomas were very rare cancers 30 or 40 years ago. Now they are the most common. They were about 5% of all the cancers about 40 years ago. Now they are about 80% of all the cancers that we see in this country.
You see so many drugs on the market for frequent heartburn.
Yes.
Do you fear that people taking these types of medications are masking the symptoms of esophageal cancer?
I'm not sure they are masking these symptoms, but what they are doing is they are not attending to the cause of the adenocarcinoma.
How would someone know that it's time to go to the doctor and get an endoscopy for possible esophageal cancer?
If someone is having persistent, ongoing symptoms of reflux that are not resolving with a short course of antacids like Nexium, that individual should be seeing a gastroenterologist and have an endoscopy done.
Are there other symptoms that you look for?
Well, the other symptoms are difficulty in swallowing, where tumor probably is already there and has caused narrowing of the lower end of the esophagus. People may end up refluxing, meaning regurgitating, bringing the food back, or they may have anemia, where they may be slowly bleeding, and if they examine their stools, they may find blood there. Fatigue, discomfort or pain in the lower part of the chest or upper abdomen.
What would be your best advice to someone who may be experiencing the symptoms that you spoke about?
The best advice is, if you have concerns about reflux that is not responding to pills like Nexium, please go and see a gastroenterologist.
Dr. Baines, thank you very much.